In Chapter 6, we explore the blood system. Endless objectives. Another name for the blood system is the hematologic system. So whenever you see heme, you know they're talking about blood. Parts of the blood system are blood and bone marrow. These parts help to deliver oxygen and nutrients to the tissues. It also moves carbon dioxide, cells, hormones, and removes waste from the tissues. Wastes are eliminated through the urinary and gastrointestinal system by way of the kidneys and the liver. The blood system plays an important role in inflammation, temperature, and water balance. What does the blood do? Deliver carbon dioxide, oxygen, promote inflammation, remove nutrients? Let's think about this. Does it deliver CO2? No, but it removes it and it takes it to the lungs to get rid of it. Does it deliver oxygen? Why, yes, it does. Does it promote inflammation? Why would it do that? Does it remove nutrients? That's the opposite of what it does. Blood delivers oxygen and nutrients to the tissues. Blood is tissue that is fluid. It's 55% liquid plasma and 45% cells. The cells include red and white blood cells, platelets, and thrombocytes. Plasma is mostly water and a little bit of proteins. When all of the cells and proteins are removed from the fluid, you're left with serum. Red blood cells are RBCs or erythrocytes. Remember, eryther is red, cyte is cell, so red blood cells are produced by the bone marrow. It makes up 45% of the blood volume and transports oxygen to the tissues. Hemoglobin is a protein on the red blood cell that combines with oxygen to color the cells red. Erythropoietin is the hormone made in the kidney that promotes the production of red blood cells in the bone marrow. Platelets or thrombocytes are pieces of cells and are colorless. They clump together to form a clot to stop bleeding. Megakaryocytes are cells in the bone marrow that produce platelets. Leukocytes, or white blood cells, are another element of blood. They play an important part in our ability to fight against infection. Different types of white blood cells have different functions. For example, eosinophils destroy parasites and increase in number when we have allergies. Neutrophils eat bacteria, virus, and fungi. The making of blood is called hematopoiesis. This occurs in the bone marrow that's stored in the middle of the bones. We talked about that in the skeletal system. Blood cells differentiate to form more specific cells like red blood cells and the many forms of the white blood cells. Also contained in blood are gases that are dissolved in the fluid. Gases such as oxygen that the red blood cells carry to tissue from the lungs. Carbon dioxide is carried away from the tissue to the lungs to get reoxygenated. Nitrogen is also present but not used. The process of stopping or controlling bleeding is called hemostasis. The blood vessels constrict, become narrower to decrease the amount of blood going out. The body sends blood clotting proteins to the area to further decrease bleeding by forming a plug to stop the bleeding. Where can you find hemoglobin? Erythrocyte, or red blood cell. Hemoglobin gives the red blood cell its color. Blood is grouped by whether it has an antigen or not. Antigens are things that the body sees as foreign, not a normal part of the body. You can have A antigens, B antigens, AB antigens, or O, where neither A or B antigens are present. Rh factor is either present as positive or negative as not present. The table here shows different types of blood, what kind of antigens are contained in each type, who they can get blood from, and who they can donate to. This is a very important table. The Rh factor is named after the rhesus monkey where it was first found. Does that make it an eponym? I don't know, because monkeys are not humans. Most people are Rh positive, but 15% of the people do not have the antigen. The problem about not being compatible is if you are a woman who is Rh negative and you become pregnant with an Rh positive baby. If the blood mixes, like during a miscarriage or during birth, the Rh negative mom will become sensitized to the Rh positive baby's antigen, causing severe issues with any subsequent pregnancy with an Rh positive baby. What blood types match? Well, O is friendly. It has no antigens, so type O can go with anyone. It's the universal donor. It's a blank slate, so it's compatible and can donate to any blood type. But O can only accept O blood. Rh positive is just like the name implies. Rh positive has got a positive attitude and can take either positive or negative blood. But Rh negative is like Grumpy Cat. It's negative. It can only accept negative. Type AB can receive any type of blood. It's the universal recipient. O positive and A positive are the most common blood types. AB negative is the rarest. There are over 600 other known antigens beyond the ones presented here. Who is the universal donor? O negative. Doesn't have any antigens, not even the Rh factor. Here are some specialists that are involved in the blood system. A phlebotomist is a doctor? Well, what is a phlebotomist? The dude that draws your blood at the lab. Are they doctors? Nope. Which one is the creation of red blood cells? So let's see what we're looking at for in a term. Heme is blood. So we could be talking about anything in terms of blood. Eryther is red. That's more specific to what we're looking for. So that leaves out A and C. So which suffix means creation? Poesis means to create. So erythropoiesis. Diseases of the blood can include clotting disorders. Hyper is excessive or increased. So hypercoagulable is increased coagulable state. Increased tendency for that blood to clot, like with a DVT, or clots in other places like the heart causing a heart attack or brain causing a stroke. A genetic disorder that leads to a hypercoagulable state is factor V Leiden. Coagulopathy is when coagulation is dysfunctional. This can include genetic diseases such as hemophilia or von Willebrand's disease. An eponym. Leukemia is a type of blood cancer. Abnormal white blood cells, leukocytes, make it hard for the bone marrow to produce normal cells and platelets. Examples are AML, CLL, myeloid, and lymphocytic. Another type of cancer would be lymphoma. This would be a cancer of the immune system. Multiple myeloma is where the cancer cells multiply inside the bone marrow, causing the development of multiple lesions. Pathology of blood gases would be decompression sickness, or the bends, that can be caused when nitrogen bubbles cause damage, triggering numerous small clots. Or carbon monoxide poisoning, where oxygen in your blood is replaced with carbon monoxide, leading to lack of oxygen in the body. Here are some other disorders. Look at the suffixes. Penia is decreased. Osis is a disease condition. So pair it with a root. Leuc is white, O is the combining form, and penia is decreased. So decreased in leukocytes or white blood cells. Thrombocytopenia is about thrombocytes in a decreased amount. Anemia is a lower than normal number of red blood cells or erythrocytes. Different types are listed here. Other types of anemia associated with genetic abnormalities are sickle cell and thalassemia. Diseases of the blood can also be infectious, like with a parasite, like malaria or a bacteria, as in sepsis. Pernicious anemia is caused by an abnormality in the B12 absorption. How do we diagnose blood disorders? By blood tests, of course. Here are some common ones. There is a urine test for pernicious anemia called the Schilling test that evaluates B12 concentration in the urine. We can also look at the source in the bone marrow by biopsying and aspirating. What is the urine test for a blood disorder? The Schilling test. Just talked about that, right? How do we treat blood disorders? Well, we transfuse new blood, either parts of the blood, like with platelets, or whole blood. The blood can either be donated through an allogeneic transfusion or autologous, which means donating your own blood that you can use later. Either way, its compatibility is a must. Donations or allogeneic transfusions are most common, so it's important to keep donated supplies up as well as each component without wasting any part of the blood. Plasmapheresis and hemodialysis both use machines to clean the plasma or whole blood respectively outside of the body. Stem cell transplantation is used in cancer treatment. Medications include anticoagulants, antiplatelets, and medications that promote coagulation. Stem cells, either self or donated, and bone marrow stimulation are also treatments available for blood diseases. Here are some common abbreviations. Well, what are we asking? What is the term when you don't have a good match? What is the disease associated with that? Graft versus host disease, right? Well, now, which of these is correct then? Correct. GVHD, graft versus host disease. What do plasma cells make? This is really a spelling question. Immunoglobulins. Which disorder is a decrease in hemoglobin and is genetic? Thalassemia. Sickle cell is genetic, but it does not cause a decrease in hemoglobin. The hemoglobin is just misshapen.